Good morning, everyone. My name is Seth Campbell. Today I'm going to be presenting on neck and back pain and helicopter crews. This topic is important to me because I'm actually in the target group. Currently on active duty, I have about 1,800 flight hours, and about one-third of those are in the last 2 years. We're going to be looking into why this issue matters, who it affects, and how targeted fitness interventions can make a real difference. Okay, so like I mentioned before, we're going to be talking about helicopter air crews, some of the causes of their neck and back pain, how this affects their health, and then what we can implement via a fitness trend to try to mitigate some of these effects. The community interest for this presentation is going to be helicopter air crew, particularly those in the H-60 airframe. The data collected is through multiple military branches, not just the Navy. The H-60 is one of the most common airframes used in the United States military. One thing to note is that throughout the multiple studies, the reports of back pain ranged anywhere from 51 to 92% amongst helicopter crews, compared to the general population who only reports 12 to 33%. So this is a large disparity in reported back pains. Some of the causes, particularly to the helicopter community, are whole body vibrations, which is a unique vibration that the airframe gives off, that your whole body experiences while you are in the airframe. This is amplified due to the cramped position that you're put in when you're in the cabin. You can't quite stand up, and if you sit down, you're not sitting down in a comfortable position. This is even more amplified due to long flight hours, duration of flight, as well as height seems to be the biggest factor. So people that are taller obviously have a much bigger problem with getting into a comfortable position to where their body's not experiencing these effects. The reason this is a problem, a lot of people are getting out of the Navy and other services between 6 to 10 years, which is usually at the end of their first contract or the end of their second contract, because either they have some form of disability or they can see the writing on the wall and they no longer able to put their body through what it's being put through. All right, now we're going to talk about the health problem for helicopter air crews. We talked about neck and back pain, but why is this neck and back pain occurring? So these are due to degenerative changes in their spine, particularly cervical lumbar spine. So these degenerative changes, they lead to constant pain, stiffness, loss of range of motion, and radiculopathy. So radiculopathy is pain, weakness, numbness, and tingling caused by irritation or compression of the spinal root nerve. And if this is left untreated, it can result in irreversible nerve damage, right? So this is a serious concern. One thing to note is that the environmental factors that we talked about, so cabin space, aircraft vibrations, those things, they can't be changed. Some additional factors that contribute to this, that's the flight gear that they're wearing, it's extra weight, which is more weight on the spine, which is being affected by those vibrations, the helmet, night vision goggles, things like that. You can't really change those. You can't take them away. These are required items that you need to wear in the aircraft. But what you can do is you can use fitness to condition the body to better withstand these vibrations, which are causing these degenerative spine changes. All right, so now we're to our fitness trend. And this community is a large community, ranging from people that have been doing it for 15 to 20 years, from people that just started today. So with that, we decided to implement kind of like a two-pronged approach. That's going to implement a National Strength and Conditioning Association Tactical Strength and conditioning facilitator. So TSAC-F is going to be the abbreviation for that. So they're primarily going to focus on tactical performance, injury prevention, and operational readiness. And those are going to be for the newer guys and people that are not currently experiencing any sort of neck or back pain or injuries. And then the second person who's going to be implementing is going to be a physical therapist, right? They specialize in corrective training, and then they provide clinical judgment. So they can determine if this injury needs further evaluation by a surgeon or orthopedic surgeon or neurological surgeon or somebody that needs to go a step further than just physical therapy and fitness. So they're there for that. The goals for implementing our trend is preparation, recovery, and maintenance. That's going to improve long-term health as well as readiness for the community. If you're experiencing these negative health conditions, then obviously you're not going to be able to do your job very well. All right, so why did I choose the trends that I chose? So in the Aerospace Medicine and Human Performance Journal, Brandt and colleagues stated that individuals suffering from back pain generally lose stiffness between spinal motion segments. However, pain may be reduced if the individual is able to train muscular motor patterns to increase spinal stability. So this is where the primarily like core focus comes from. This was a pretty extensive study that they did on helicopter crews on how to mitigate back pains. And then I threw in some civilian studies as well for other data. So in the Korean Journal of Pain, they compared random exercises for chronic neck pain in a controlled study, and that study was done by Gamuscu. And they found that programs combining cervical and core stabilization produced the greatest improvement in posture and pain reduction. Particularly deep cervical flexor training restored range of motion as well as mitigated a lot of the pain. And then another study that I looked into was in the International Journal of Sports and Physical Therapy. And that one was conducted by Smersina, as well as some of their colleagues. And this was a review on core stability and mitigating non-specific low back pain. So it's more of a general, how do we fix low back pain? And again, they found that core stabilizing exercises reduce pain, improve function, and then enhance spinal control. So all these things allow you to have more control over your spine, your neck. It reduces the effects of those vibrations put out by the airframe. You still need to maintain good posture, but having that strength where you need it in those targeted muscles are going to mitigate some of these effects. So I looked for things that decreased pain, increased range of motion, and then improved posture. Some of the exercises in these studies, these are in no particular order. These are just exercises that I found that had the greatest effects. So squats, they target multiple muscle groups as well as activate your core. Deadlifts do the same. The stability ball exercises, those focus on, those small muscles. Planks, obviously good for the core as well as the back, bridges, and then the deep cervical flexor. There were a few more, but particularly looking for exercises that stabilize the core and correct any issues in the spine to able to tolerate the vibrations of the aircraft. All right, so I broke up the fitness trend into 3 phases. So we got pre-deployment, post-deployment, and then the maintenance phase. The pre-deployment phase is going to focus on mobility, spinal stabilization, and whole body conditioning. So this is going to help build up that resilience and the tolerance to the vibrations that they're going to be exposed to throughout this deployment. Some exercises to include in there, you could do side planks, bird dogs, glute bridges, focusing on core and then thoracic rotations to build that that core strength. And then at this point, you're going to establish a baseline, like where you're at before deployment for control, stability, flexibility, all those things. And that data is going to be recorded to see what happens in the post-deployment phase. So you come back from deployment and your baselines are already set. This is where you work mainly with the physical therapists, and they're going to look at what changed throughout this deployment. And they're going to implement any corrective training that needs to be put in to restore the range of motion, reduce any pain that was built up, that was new, and then just fix what went wrong with the body while in there. And some things that can be implemented in here: more stabilizing work, targeted exercises to correct anything that was thrown off during a long deployment. And then once you get through this phase, you're going to move into the maintenance phase, which is you're going to do progressive strength training, try to improve flexibility, and then continue the stabilizing, the core stabilizing training that you did in the pre-deployment phase to work up to that, back into that pre-deployment. It's a continuous cycle: preparation and recovery, and then just maintaining all the things that have been put into place. Ideally, this is going to increase readiness and improve quality of life and everyone involved, so they're not affected by all the environmental factors that they're put through in that aircraft. All right, so how are we going to implement this trend? So staffing, we talked about the one physical therapist and the one TSAC-F. Looking at that per squadron, each squadron on average has about 50 enlisted flyers and probably 20 to 30 pilots. So that's a good number, because if you're working 2 to 3 times per week, you can spread that out throughout the week, and each of those individuals can be seen. So pre-deployment, we're looking at 2 to 3 times per week, roughly 30 to 60 minutes per session. Post-deployments, 2 times a week, and then the maintenance phase is 2 times a week. This can be done in a gym. So if there's a gym nearby on the air station, they can utilize that gym, or it can be done in the hangar. Minimal equipment is usually required for each one of these exercises that I listed. Most of them are body weight exercises, so very little equipment is required. Some of the data that they're looking to collect, so this is going to be in the pre-deployment phase, is the pain scale. So it's the Defense and Veterans pain rating scale. So that's just a numerical number between 1 and 10, based on different categories, like how does it affect you in your day-to-day life, how does it feel, things like that. And then the NDI, that's going to be your Neck Disability Index, and that's going to cover, it's a self-reported questionnaire, covers 10 different items, which is pain intensity, how does it affect your personal care, lifting, concentration, sleep, and then things you're able to do recreationally based on your pain. Each one of those is on a scale of 1 to 5, and then that gives you your ultimate disability score. Then we're going to be looking at posture and then flight status. So for us, that's, are you med up or are you med down? So if you're med down, we'd like to get you med up. So goals: decrease that pain scale by 2 points, decrease the neck disability index by about 10 points, increase range of motion. That's subjective based on everybody, because their range of motion is going to be different. And then flight status, we want to take people that are med down and bring them back to med up so they can fly. Ultimately, increasing readiness and then quality of life. All right, so I'm going to talk about some of the challenges that we would face trying to implement this. The biggest one is funding and then getting it prioritized by leadership. There's not a clear consensus in the community of what needs to be done first. Everyone's focused on the gear aspect of it, heavy vest, heavy helmets, heavy night vision goggles. All of these are contributing factors to the degenerative changes in the spine, because the more weight that's put on your spine, the more your spine is affected by those whole body vibrations. Particularly, there's an article put out by the U.S. Naval Institute and discussing all of these changes, how gear is the easiest way forward, if you reduce the weight of gear, these problems are going to be solved. Which I do believe if you reduce the weight of the gear, it's going to have a great effect on the overall degenerative changes of the spine, but it's not the ultimate fix. The biggest concern in this article is it says that physical fitness was no indicator on disability rating, and that exercise is not the answer, that gear is the answer moving forward. I think that's a pretty hostile look on things. I think it should be a collaborative effort. Like, yes, you need to change the gear, but also fitness is something that can be implemented now at a relatively low cost. It doesn't require a whole lot of money. You're just paying individuals to conduct the training. It's easy to implement, and then it's scalable. It can be done anywhere quickly. It doesn't have to go through the bureaucratic processes of being voted on and approved by the controlling agencies. It's just physical fitness. You put it in, and it can be done daily, weekly, and it will work together with the gear that is being changed to make these improvements. That's not saying that gear is not a priority. It's just saying that fitness is easier to implement than whole gear changes. And obviously, the airframe you can't change. That's not going anywhere. That's millions of dollars to fix. All right. So why does this trend fit? So the risk factors, vibrations from the airframe, posture, due to the confined spaces, and then the long flight hours. Stabilizing exercises directly address the muscle groups for stabilizing the spine, which is going to mitigate those effects of those whole body vibrations. Correct posture, so hopefully that you're in a more anatomical correct position to better mitigate those vibrations. Minimal equipment's required. You basically just need the space, and it's scalable across all squadrons, all air wings, all branches of service, really. And then it aligns with pre and post deployment training. It's easy to work in a 30 to 60 minute exercise routine, pre deployment, post deployment. You're just changing what you're focusing on in those exercise routines. It's relatively low cost, and it can be rolled out almost immediately. There's nothing really stopping you from doing these exercises. Uh, the biggest factor is getting the funding to have the trained personnel there. So that's going to be the physical therapist and then the TSAC. All right. So in summary, we talked about helicopter air crews. Biggest thing, back pains reported in 51 to 92% of personnel, depending on which study you're looking at. That's a huge number. We talked about the causes, so the vibrations from the aircraft, the posture due to the cramped environment, the gear that they wear, how increasing flight hours can greater affect that. So the longer you've been doing it, the worse your condition is. We talked about the fitness trends, so core stability exercises, as well as targeted cervical and lumbar exercises to improve those things. And ultimately, if you implement these things, it's going to improve readiness and hopefully improve long-term health amongst the entire community. All right, these are the references that I used both for the paper and for the information I talked about in this slide. All of the articles have hyperlinks if you'd like to look into any of the studies or any of the exercises that were implemented